Post-operative instructions after the rhinoplasty, the nose surgery. See, your nose will be packed for 24 hours. We don't want you to go back to your home for 24 hours, because after 24 hours we remove the pack and we'll make you free so that you can breathe through your nose. The first 24 hours your nose will be blocked, so you have to breathe through your mouth. Sometimes I advise the patients, even prior to the surgery, just practice that nose blockage and come prepared for the mouth breathing. And that's the only hindrance after the surgery, because your nose will be blocked. Sometimes the blood will trickle through the nose and we keep a gauze here, so that once in 2-3 hours when the gauze becomes soaked, we change the gauze packs continuously till you get discharged. See, the pain after surgery is very negligible. Usually patient never complain of any pain after surgery. You will be on painkillers, but it's not a painful surgery. And when you're going back home, we'll start you on 2 nasal drops. One is the decongestant drops like Operative. Other is the saline drops for humidifying your nose. So saline drops has to be used every second hourly. When you're sleeping, not a problem, but when you're awake, try to use every second hourly the saline drops. The Operative, the nasal decongestant drops, has to be used every 4th hourly. So you go back on the first post-operative day, that is after 24 hours from the time of surgery, and I want you to visit you on 3rd day or 4th day, because what happens is sometimes blood clot will form inside the nose. That the blood clot becomes, when it becomes harder, it itself pulls the skin down, so that deformity might happen in few cases. So that's the reason, and more than that, you feel also very uncomfortable because of the nose blockage or because of blood clots. When you are coming on 3rd, 4th day, we clear the blood clots and make you comfortable. Then you go back on the same day. 7th day when you are coming back, we remove the splint and we see the nose how it is, and we remove the sutures. If I perform the open rhinoplasty, we remove the sutures on 7th day. And during this 1 week, we will put you on the painkillers and the antibiotic medications and the nasal drops, as I said earlier. After surgery, when you are sleeping, try to keep your head elevated so that swelling will be less. And first 1 week, we will put you on some liquid diet. See, usually most of the doctors nowadays don't advise a liquid diet, but still I feel when you are on liquid diet, you are going to eat very healthy food so that the swelling is very less. Usually if you reduce your salt intake and eat healthy food like vegetables and fruits rich diet, the swelling will comes down faster and you recover faster. You can't cut down the salt, because when you cut down the salts you feel very tired. Reduce your salt intake as much as possible so that your swelling will be very less and you will recover faster. Sometime before surgery itself, say example you have a very oily skin and your inside that tip activities are more. So what we do is we put you on some tablets called isotretinoin. Usually we started with 5 milligram even before surgery, and after surgery we need to continue for 2 months. And the nose splint will be continuously applied for the first week. Then you come to the center on 7th day, we remove and show you the results. That is the happiest moments. You can see the almost 70 to 80% of the results, but still swelling will be there. And again we reapply the splint for another 1 week, because Indian skin type, the swelling takes longer time to disappear. In this molding, I personally feel will help to get the very good results. On 3rd day when you are coming, what we do is nowadays we use something called a nasal retainer. The retainer is nothing but there is a silicone material inserted inside the nose, so that nose opening will be supported, and that silicone opening, that nasal retainer has the opening in it, so that you can breathe easily. That we take the measurement for your nose on the 3rd day when you are coming for the clot removal, and then that we get it usually 2 to 3 days after we order from Delhi. So we get that splint on 7th day. From 7th day onwards, we advise you to use the nasal retainer and continue for a month. And this splint, I want you to use it for 14 days totally. 7th day we remove and show you, and after that you have to apply it for another 1 week. Then after 14 days, try to use the splint as much as possible. At least in the night time, you use it for another month. That really helps in molding the nose skin well. And from 14th day onwards, we want you to do a nose massage. Okay, nose massage is very important. A lot of patients ask how to do it. I'll demonstrate in this video how to do the nose massage. Okay, so basically you have to apply some moisturizing cream and give a nice firm pressure over the nose bridge. Basically, we are displacing the swelling from the center midpoint to sides. So you give a nice pressure, displace the swelling, go down all the way till the side of the eye and come back again. Here, if you finish the upper part, come to the middle part and do the massage and go all the way to the side of the face, again come back. Give a pressure here, go like this and leave the swelling to the sides and come back. The tip, you have to do a massage like this. So do this massage for 5 minutes for at least period of 3 to 4 times in a day. It really helps. And one other problem what we normally see is because of the bone narrowing. Some people we narrow the bone by doing a breakage of the bone. So there will be a little blood clot here. What happens is this blood will seep through the under eye region. Because under eye skin is very soft and easily expandable, so the blood will come and sit here. So that you see a black eyes after the surgery. To prevent that initial after surgery itself, we put a plasters here. So this plaster will prevent the blood clot accumulation in the under eye region, but sometimes even after that it might happen. This under eye darkness, the under eye that black pigmentation, the blackness will disappear after 3 to